Recently at MEDINFO 2023 in Sydney, I had the opportunity to sit down with two representatives from Daedalus, Dr. Michael Dahlweid, Chief Product and Clinical Officer, and Stephen Parrish, Chief Medical Information Officer for Asia Pacific. Daedalus are a global provider of healthcare IT solutions dedicated to improving patient outcomes and advancing medical research through innovative software. In this discussion, we talk about the release of Orbis in Australia, which is a comprehensive EMR system designed by clinicians for clinicians. We delve into the origins of Dedalus and their successful growth story across the globe. We talk about the importance of standardisation in healthcare technology and the promise of AI and ML for the future developments in this space, plus a lot more too. Collaboration starts with a conversation, Team HealthTech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare.
So Stephen Parrish, I'm the Chief Medical Information Officer for Daedalus, Asia Pacific. So I've been with the company just shy of 2 years. My background is in nursing. I did clinical nursing for 10 years before finding my passion, which was technology and being a geek at heart. Then came into the technology world and been doing that for, 20 odd years or more. Been CIOs and at different places in Australia and New Zealand, worked overseas in the US, Malaysia, Singapore as well. So, yeah.
The self-professed clinical technological geek, my kind of person. But and what about yourself, sir?
A clinician myself. Actually a nurse, to be frank. I started as a nurse, then became a doctor. Yes. Specialized in trauma surgery. And I bumped into IT stuff and made it my future career path. I've been in the industry for quite a long time, mostly working for global health IT companies, including a stint at GE Healthcare over in the States. And I'm with Dedalus for quite a bit, and I'm their global chief product and clinical officer. That means whatever products we've got, it is my responsibility to make them sort of work.
Yeah. And you're visiting here in Australia, right?
I do, yeah.
And where are you based normally?
Out of Switzerland.
Yeah, nice.
Yeah.
Nice, there you go. Actually, we're looking at pictures of head office of Daedalus before, and it's the views here in Sydney are nice, but it's not the same as Milan. But a bit more about Daedalus. So people here at the MEDINFO conference would know that you exist and perhaps know the brand and globally as well. It'd be great to get a bit more context in terms of what the company actually does and where you operate it.
Yeah, so Dedalus is a private equity-backed company which since 2016 grew 10 times.
Wow, okay.
We did a few acquisitions, big acquisitions, and a lot of smaller acquisitions, and we are approaching €1 billion top line these days. And we are operating in 42 countries across the globe, but the main activities are based out of Europe, where we do EMR, PaaS, in-hospital activities, but as well as in vitro diagnostics, in vivo diagnostics, imaging diagnostics, and even ERP in healthcare, analytics, primary care, and patient engagement.
Wow!
Just to give perspective, like if you would go to Germany, the likelihood to bump into our products in any of the given German hospitals is 70%. That's our market share we've got there. Yeah. When it comes to diagnostics businesses, for example, in France, 60, 70%, in Italy, 80%. We have 80% of the primary care market in Italy. So we are big in Europe. Actually, Klaas just quoted us #1 EMR vendor outside the US.
Oh, wow. Okay, there you go. And so, but here in Australia, Stephen.
Yeah, I guess what Michael spoke about was the history of Daedalus overseas, but we became part of that history about 3 years ago when DXC Healthcare got bought out by Daedalus. So we've been in Australia and New Zealand for 30 odd years as a company in their various iterations. We've brought all that knowledge and experience of the New Zealand market with us into Daedalus. And so the beauty of that is we now have that knowledge and experience of this market, but the opportunity to bring products that are from Europe and specifically Germany, etc., with that experience of the socialized medicine sector and bring them into this market now.
And DXC wasn't a small little corner shop either. That was
no,
a
it
big
wasn't.
Pressure.
No.
So,
but the health business in DXC was just one part of what they did. In Daedalus, healthcare is what we do. It's all we do. It's our passion. It's what we're focused on 100%. So it's very different to being part of DXC, where you're just one of the line items. We are the line item in Daedalus.
And I imagine that would allow you to then really lean in and solve some problems. And what I hear and see at the booth here is a lot of talk about Orbis from Dedalus. And I know it's a product that's existed outside of Australia. Is that right, Michael? And coming in, firstly, tell me a bit more about Orbis globally.
So Orbis is a product which exists since 1996.
Okay.
And it is now in its third iteration. Mm-hmm. And Orbis has been done 3 times from scratch.
From scratch, right?
From scratch, literally from scratch. So not bolt on and bolt on and bolt on, from scratch. So it has, give or take, 1,000 hospitals, 44% market share in Germany, a third of the Austrian market, right? Yes. We are active in Switzerland. We have 100% market share in Luxembourg, huge, 30% in France. And we've entered the UK and Ireland with Orbis just last year. So it is a well-proven, clinically focused product, again, which is well known, well regarded in mainland Europe. Mm-hmm. Yeah, and we are just now in our, as I said, third iteration. The latest edition, if you will, is all Fire-based, microservice-based, HTML5, cloud-enabled, cloud-ready, cloud-deployed, all standards underneath. And the main mantra for what's behind Orbis, it is built by clinicians, for clinicians, using the, let's say, clinical UX usability principles.
Got you. And well, I want to come back to that point in a second too. But first, I want to just understand a bit more from your perspective, Stephen, knowing this market really well. Where do you see Orbis solving some problems in, say, the Australia, New Zealand kind of market?
Yeah, I have been in the market a long time looking at various electronic medical records, and what I like about Orbis is, predominantly the user interface, that how a clinician would use the system on a day-to-day basis, and how it's simple. How it gives you the information in a view that makes sense to you and what you're doing at the time. But more so than that it has that footprint of overseas that provides some comfort, that it has the depth, the breadth, and it has the experience to run systems, and it's socialised medicine based. So I think that's really important for us in Australia and New Zealand. I think something that's more aligned with the way our system operates, our healthcare system operates, our market operates, is really important. But as I said, probably the predominant thing is the usability for a clinician. It's based on workflow. It's based on how they work, not how we want to bill a patient or how we want to do some of those more administrative functions. It's based on how a clinician works to provide clinical care for the best outcome for the patient.
Yeah, and that's interesting in itself, right? Because often the way a piece of technology is built is perhaps from a technician's point of view, or from the driver's point of view, like you say, how the system is built, how the finances work. But you're both clinicians and both know the space well. Why is it so important to you, Michael, that these types of solutions are built? It's nice to say by clinicians for clinicians, but in the end, there's still billing that needs to get done, and there's still like a business that needs to be operated. And often the software supports the business. How do you find that mix?
Yeah, however, you have to make sure that you do not burn your most important assets you've got as a provider. And if you force folks to work with something which is adding to your fatigue, you will lose. You will lose as a provider because you are burning your clinicians, and therefore, to provide the service you need to bill those services will get impacted. Yeah. And therefore, to focus and to invest in usability, allowing folks to wanting to use the system, the wow factor, I'm calling it. Yeah, it's a differentiator.
Yeah,
it is.
I mean, how often do you find it, Stephen, that you've got clinicians that are like
demanding to use a system. Often it feels like it can be forced down upon them, but it
depends on the clinicians. There's lots of IT-focused clinicians out there that see something shiny, and they'll, my experience as a CIO, they'll come back and want the next shiny thing. But then when you go into what's the problem they're trying to solve, and I guess that's the key for me, is we need to understand the problem and then tie the solution to the problem. And Orbis allows us to build the workflows around the problem to solve it, not trying to hit a square peg into a round hole, so to speak.
And I think about just generally in a hospital setting, and I'm just even thinking in Australia, so I'd love to hear from your side, Michael, about globally. You're in so many different hospitals and settings, and on one hand, as a technology provider, you want to have it standardized, systematized, scalable, so that then you could just push this thing into every clinical setting and they use it as prescribed. But as we know, every single hospital is a little bit unique, and they want all these kind of tweaks and changes to fit it into their system. How do you at a large scale, like a company like Daedalus, how do you find that balance between building a scalable solution but also tailored to individual needs?
We do see a almost total shift towards, hey, please help us to standardize.
All right.
So we have seen every single mom and pop shop sort of hospital wanting to do their own thing. That's over. These hospitals, small and large, are starting to ask more and more and more, hey, please help us to get those workflows, those guidelines, those standards implemented. And even though they're almost kind of, sorry for saying it, misusing a tool to implement their best practice standards, they do it. And that is what we see more and more and more.
That's interesting. Like, as you say that too, I'm thinking about how healthcare works generally. It's you have peer review, and you have you're looking at what the best standards are, and often if it's been demonstrated in one location, then it's something that's capable here too. So I imagine that kind of applies to the technology.
And again, a couple of years ago, it was all about, no, we are special and special and special. No, that's changing.
Interesting.
Yeah, I tend to refer to it as good practice as opposed to best practice, because the effort it takes to become best practice means that by the time it is best practice, it's already outdated because something else is good practice that is surpassing it. So we need to be more focused on good practice and good practice for the organisation, but standardise where possible, but also have the ability to localise where it makes sense to. What I find is large tertiary organisations don't work the same necessarily. They have the same outcomes, the same processes they want to implement. Then a small rural don't have the same staffing, the same things in place to do the same things the same way. Still want the same outcomes, but we need to be adaptable for those different scenarios.
And think about the future then for Daedalus and Orbis, and it's exciting that launching here in Australia with the Orbis solution and hearing all the great things happening overseas. What can we look forward to seeing from Daedalus over the next 6, 12, 24 globally?
Orbis for sure, which is getting more and more built-in, AI and ML-based decision support. Mm-hmm. We just started implementing medical device regulated predictors, which are ML based. In Europe over there's a strict regulation in terms of what you can do and what you cannot do. And you have to go through what's called notified bodies to get those predictors into real life. We went through it. It is published. It is being clinically trialed. And we do have it for acute kidney injury, for post-op delirium onset, and for non-ICU acquired sepsis, for which we, have a market within Orbis, allowing to utilize all the data sitting in Orbis to get to make even more sense for clinicians. Yeah.
Excellent. Where's you're all Orbis? You're the face of Orbis.
The face of Orbis. Yeah, thanks. I didn't want you to say that.
That's why I said it.
Yeah. Look, for me, the exciting thing is just being part of Daedalus as a global entity, in that there's more opportunity for us to look at the Australian New Zealand market, see where the gaps are, and look at opportunities to plug those gaps with things that come out of Europe and the company and what we've done overseas. From an Orbis perspective, for me, it's about getting the first customers, taking up Orbis, being able to work with them to really prove the value of Orbis that we know exists, but we need to prove that in the Australian New Zealand context. And so that's my focus for the next 6 to 12, 18 months. It'd be great to get a couple of customers on board so we can really shake up the sector a bit here and show what's possible.
Yeah. Well, I mean, it's the right time, isn't it? It's such an exciting place to be when you've got that demonstrated capability locally and now backed with the really good product that's also demonstrated globally. So looking forward to seeing how that kind of plays out over the coming months and beyond. So look, Steve and Mike, I really appreciate you making the time to have a chat in the busy schedule here at MEDINFO today.
Thanks.
Thank you. Appreciate it.
For more content and community about technology and healthcare, visit talkinghealthtech.com.